Suddenly, we were witnessing few babies who are born to a mother of less than 35 years, 30 years, suffering with autism and mental disabilities, where they became so deeply disturbed. And then couldn't understand what could be the reason. This is not as per the recommendation. The medical literature doesn't recommend to do such testing in a women of 30-35 years, but suddenly we are witnessing such abnormal children, mentally disordered children. I'll give one technique where you can take care of yourself in unavoidable circumstances. So now we are entering into the 15th topic. This is another sensitive topic, that is treatment for the elderly couples. So what is that age group of elderly couples? It is something like who are above 35 years. Okay. Nowadays this is becoming very common. Late marriages, postponing pregnancy is becoming very common, and it is multifactorial reason. And some of the thing is like certain things can be avoided and certain things cannot be avoided. So that is also a point in it. I want to tell one thing. There are some misconception among the human population or among the couples or the people. What is that is like they want to settle themselves well. They want to complete their career, they want to finish their studies, or they want to finish the achieve that position in the work, and then they want to start the thing, or they want to enjoy for few years after the marriage, though they are married late. After that they want to enjoy for few years and then they want to plan for a baby. So these are all some of the reasons which are commonly cited. And what is happening is like among this, some people are having this thought like if we can spend money, if we are really having good money to spend for ICSI and all, we can achieve pregnancy. So this is something very, very wrong mythology. And how I am trying to make you understand is when now I almost crossed 25 years of practice in this medical profession. When 15-20 years before, when we do practice in medical healthcare, what will happen is when a female partner who's pregnant, who's going through this antenatal time, pregnancy movements, generally we do this down screening, autism, this other special test for neurological abnormalities and all. We do this test in the first trimester, in between 7th to 10th week, for female partner of above 40 years. This was the cutoff age. Then what happened is suddenly we were witnessing few babies who are born to a mother of less than 35 years, 30 years, suffering with autism and mental disabilities, where they became so deeply disturbed. Then couldn't understand what could be the reason. This is not as per the recommendation. The medical literature doesn't recommend to do such testing in a women of 30-35 years, but suddenly we are witnessing such abnormal children, mentally disordered children. So then now what has happened is there is no age cutoff. Irrespective of your age, everybody is going through this trisomy testing, this mental disorder testing in the first trimester, and alarming results are all coming up. And that is another technology. Very precisely they are upgrading the technology. So now what is the concept is we need to understand where are we going. If we are going to give a generation, next generation with so much of mental disabilities and mental disorders, what is the use in getting that life for them? Will they be happy, or will you be happy giving such children and taking care of them? Only when you speak to the couple's parents who are looking after these special children, you will realize the pain of it. You will realize the real mental agony and mental trauma. So now we need to understand, elderly couples, don't take it lightly. My first and foremost instruction is, if there is an opportunity where you can get your marriage as early as possible and plan for a baby without any delay, if there is an opportunity arises, please complete it. And always, this is my view, I will not allow anybody, if anybody couples come and ask me, I'll tell, always have 2 children. Don't stop with one child. is always better. They need one-to-one support each other after our life. So 2 children is always good. So these are all some of the common things which I advise my couples when they are seeking my opinion. So now I'll give one technique where you can take care of yourself in unavoidable circumstances. Due to some serious family problems, you are not allowed to undergo a marriage at early age. Unfortunately, you are landing in marriage in late 30s and then planning for a baby. In that case, if that situation is arising, for a men and a woman, they can go for a sperm freezing, egg freezing. Now, like blood bank, semen bank, egg bank, embryo bank, all these banks have been available. So you can freeze your sperm and egg, which is good at your young age and which can become bad at your elderly age or an advancing age. So this is a safety measure. But having understood this, not try to utilize this as maximum, because this is only in unavoidable circumstances. Even this is also an artificial method. So when you are getting to that elderly age group and unfortunately your sperm and egg has gone down in the numbers or gone down in the quality, then you are ending up in treatment and the treatment is not giving proper progress or results, then you are left with no choice of going for a donor programs. In those unavoidable circumstances and all, this sperm storage and egg storage will be of much help for you and will try to give a solution for you. So my concern is, my advice is for you all is, if you are elderly age, there are treatment is there even at that age, because you are not having this awareness, you have not done any sperm freezing or any egg freezing. Even in this situation, still the positivity lies in you. As I said on every topic, you cannot increase the quantity because your quantity is already compromised. But with the available quantity, you have the choice of improving the quality. This is very important. You need only one baby, and that one baby is nothing but a byproduct of one sperm and one egg. Even the woman who's having relatively less reserve compared to men in terms of sperm and the egg, they are producing only 10 to 15 eggs in a regular monthly menstrual cycle. They need only one egg to get a positive pregnancy and a healthy baby. So if your eggs have gone down drastically, you are having only 4 to 5 eggs or only 2 to 3 eggs, try to make that become first, improve in the quality. Then by your proper uncompromised treatment, if you can improve the quantity, that is most welcome. There is a possibility. Okay, so you need to understand this fertility health is not an individual problem, it is not an isolated problem. Fertility health is an end product of physical problem, mental problem, social problem, psychological problem, emotional problem. And with all this problem, it ends in fertility problem. So fertility is not a couple disorder. It is a society's challenge. It is a community's challenge. So we need to understand and also keep this in all in your mind. When you are postponing your pregnancy because in elderly age, and by chance even if you become pregnant, the children will go at a later age. And when you need a dependency, your children may not be able to support you. So with all these things has to be kept in mind, and you have to really think properly and plan everything at the right moment. See, there is a very famous say, adaduk nadakka vendiya nerathil nadakkum. Correctingala. See, if you want to, the marriage should happen between, you should complete your education, you should complete your marriage, you should complete your family, you should settle in your work, you should become financially independent. These are all happens at ages. At a prefixed age, at the right moment. You should aim for it. Everything will have a solution. You need to really work for it. Don't say, I'm unlucky, I'm not able to get this and all. That is something not at all true. We have to take some extra efforts. By consistent, determined effort, even we can change our fate and destiny to our positive side. So you need to understand all these things. Take it positively. So now my concern is, I am very clear. I have switched over, as I told, this previous ICSI failures and miscarriages now to the elderly couples. I have changed myself because I got a problem. I got seriously thought of it. I got a solution. What is that problem? I have a soft corner for childless couples. When they are crying after a negative result, I cannot withstand it. I feel bad for them. And when they are getting repeated failures, I am feeling very bad for them. And when they are elderly age group, I am also becoming funk about them. I am also getting disturbed. I also cry along with them. So I should become mentally strong. I should make them become mentally fit. So the concern is, I switched over. I took allopathy medicine as my primary specialty, but I integrated our Indian traditional medicine, which nobody is given importance, nobody has known its value, and it is not given much concentration. Because only in our Indian system of traditional medicine, they don't treat the symptoms or they don't treat the disease. They treat the individual as a whole. If you go for infertility, they don't treat infertility as a primary subject. They will understand what is your body constitution, what is the imbalance in your body, and when they rectify it, you get the solution not only for infertility. Associated whatever the problem, you can be overweight, you can have some sleep disturbance, you can have some indigestion, you can have some constipation. Multiple problems are there happening in the body, and in allopathy we treat every individual symptoms and disease. But in our Ayush treatments, one of the wonderful treatment, they treat the individual as a whole and not as disease based. So when I understood that system and I when integrated, and when what is my solution for these couples who are having very severe challenges, and thing is, uncompromised couple preparation is the only solution. So elderly couples, you have so many challenges ahead of you, so don't delay. So we need to do a lot of preferably integrative medical approach. We can aim for a solution and a healthy baby. Let's see in topic 16.